you've probably tried to find what are the symptoms of colon cancer, I can understand that you might be concerned. It's true, this cancer is very complicated, but what you're currently experiencing doesn't mean that you have it. Being the third most common cancer in the US, early detection is crucial. But there are 8 symptoms that are common in colon cancer, so listen carefully before taking any action. The first common and early symptom you should look at is blood in your stool. However, the culprits behind this scene could range from troublesome hemorrhoids to tiny tears known as anal fissures, or even some gastrointestinal bleeding from other areas in our digestive system. Hemorrhoids, those swollen blood vessels in the rectum or anus, and anal fissures can cause a bit of concern, but the good news is that they're usually not linked to colon cancer. Now let's talk about the gastrointestinal plot twist. Bleeding might be happening in different spots: stomach, small intestine, or colon. And it could be due to issues like ulcers, diverticulosis, or even colorectal cancer. The challenge here is to decode these signals and know precisely when it's time to have a sit-down with a healthcare pro. The type of blood in your stool is like a personalized clue to this health detective game. If it's bright red, it's often a sign of something happening near the rectum or anus. On the flip side, dark or black stool might be hinting at something more profound, possibly from the colon or stomach. And here's the insider tip. Blood in the stool can sometimes play it cool, appearing as streaks or blending seamlessly, making it a bit tricky to spot. So for those who value staying on top of their game, keep an eye out for these hints and know when it's time to bring in the experts. Now, if you're experiencing frequent abdominal pain and discomfort, I suggest you monitor it closely. Abdominal pain linked to colon cancer is often characterized as crampy, intermittent, or persistently nagging. Typically found in the lower abdomen, it may occasionally be accompanied by a sense of bloating. It's essential to understand that abdominal pain is a broad symptom, not exclusive to colon cancer. Various conditions like irritable bowel syndrome, diverticulitis, or gastritis can also bring about discomfort in the abdominal region. However, when abdominal pain is coupled with other red flags, such as alterations in bowel patterns, unexplained weight loss, or the presence of blood in the stool, it raises a more alarming scenario. This combination of symptoms should trigger immediate medical attention, as it could signify a more serious issue, potentially related to colon cancer. Recognizing a significant drop in weight without a clear cause is not a typical occurrence is crucial. In the medical realm, a weight loss exceeding 5% of one's body weight within 6 to 12 months is generally considered unexplained. Sure, if you follow a strict diet or exercise regularly, that would explain it. But while various factors can contribute to unexplained weight loss, it becomes imperative to entertain the possibility of an underlying health issue, especially when accompanied by other symptoms. When it comes to colon cancer, unexpected weight loss can be attributed to a couple of factors. Firstly, the tumor's presence may hinder the absorption of nutrients in the colon, leading to nutritional deficiencies. Moreover, the body's immune response to cancer can rev up metabolism, causing an individual to burn more calories than their usual rate. If you're consistently losing a significant amount of weight, it's important to reflect on how frequently you experience fatigue. While discussing fatigue and colon cancer, it's intriguing to note that studies have suggested a significant association between the severity of fatigue and the stage of colon cancer. In some cases, individuals with advanced stages of the disease may experience more pronounced fatigue, further emphasizing the potential impact of cancer progression on energy levels. Research has explored the role of inflammatory markers in cancer-related fatigue, including colon cancer. Elevated levels of certain inflammatory markers have been observed in individuals experiencing cancer-related fatigue, providing insights into the complex interplay between the immune system, inflammation, and the energy-depleting effects of the disease. While fatigue is something you could easily notice, anemia is a colon cancer symptom that might be difficult to spot. Anemia happens when your blood doesn't have enough healthy red blood cells to carry sufficient oxygen to your body's tissues, and the data indicates that gastrointestinal bleeding from tumors can contribute significantly to anemia, emphasizing the importance of vigilant monitoring for early detection. It can stem from various causes, like not getting the right nutrients, dealing with chronic diseases, or having bleeding disorders. Colon cancer's link to anemia comes into play when the tumor causes hidden bleeding in your gut. This quiet bleeding can gradually lead to a notable loss of blood, resulting in fewer red blood cells and a decreased ability to transport oxygen. The signs of anemia can differ, but they often include feeling tired, having pale skin, experiencing shortness of breath, and having cold hands and feet. It's crucial to grasp that while anemia can signal the presence of colon cancer, it's not the exclusive messenger. Other things, like low nutrients or chronic diseases, can also ring the anemia alarm. That's why another option is to check your rectal health. It's because rectal bleeding happens when blood appears from the rectum or anus, and you might spot it on toilet paper or in the toilet bowl after wiping. The blood's color can range from bright red to dark red, depending on its origin and how long it stays in the digestive tract. Various conditions, including hemorrhoids, anal fissures, or gastrointestinal bleeding, can be linked to rectal bleeding. Hemorrhoids, those swollen blood vessels in the rectum or anus, often lead to bright red blood. Similarly, tiny tears in the anus lining, known as anal fissures, can also cause rectal bleeding. But here's the catch. If rectal bleeding becomes constant, severe, or comes with other worrying symptoms, it's time to take notice. It could signal an underlying problem. And yes, that includes the possibility of colon cancer. Colon cancer may trigger rectal bleeding when the tumor bleeds into the colon or rectum. This kind of bleeding can lead to dark or black stools, as the blood mixes with stool during its journey through the digestive tract, just as we discussed at the beginning of the video. But what we've not mentioned is constipation, a common digestive woe that almost everyone encounters at some point. It's marked by infrequent bowel movements, trouble passing stool, or hard, dry stools. Typically, it's a passing hiccup that lifestyle and dietary tweaks can fix. However, when constipation sets up shop for the long haul and brings along other worrying signs, it's time to sit up and take notice. Now, chronic constipation means having fewer than 3 bowel movements per week and dealing with this over a significant stretch of time. The tumor in the colon can create roadblocks, disrupting the usual flow of stool. This can translate to difficulty passing stool and a drop in the frequency of bathroom visits. Crucially, we need to differentiate between occasional constipation, usually caused by temporary factors like diet, stress, or other lifestyle choices, and chronic constipation, which might be a subtle indicator of something more serious, such as colon cancer. While constipation often grabs our attention, its counterpart, persistent and unexplained diarrhea, deserves a spotlight too. Diarrhea, with its frequent loose and watery stools, can be triggered by various factors like infections, dietary choices, or underlying health conditions. Probably not something you wish to experience. But there's an unexpected link between colon cancer and chronic diarrhea. When a tumor decides to set up camp in the colon, it can disrupt the normal journey of stool. The body, in response, might turn up the frequency and looseness of stools, resulting in persistent diarrhea. Here's the kicker. Chronic diarrhea isn't just a minor inconvenience. It can lead to dehydration and nutritional deficiencies, making it more than just a bathroom concern. Acknowledging the significance of persistent and unexplained diarrhea is crucial, not just for comfort, but also for understanding potential health issues, including the prospect of colon cancer. So when your digestive system starts signaling in this way, it's like a call to pay attention to the bigger health picture. Now, if you have any of these symptoms occurring often, you must check with your healthcare professional. But if you want to help your body right now, think about your diet first. The following would help your other organs, such as the pancreas. And you must be aware of these 10 foods that are good for avoiding pancreatitis. Don't forget to like and subscribe if you found this video informative.